This is Dr. Connolly with a brief video about transforaminal steroid injections for disc herniations with information about what an injection is, why we do it, and some answers to common questions. Transforaminal steroid injection is a 10-minute procedure guided by X-ray. We place local anesthetic to numb the skin, and then we selectively target one nerve. Put some dye to outline the nerve, some Novocaine to numb the nerve, and then we place steroid medication. This is a spinal model showing the area where the nerve exits the spinal canal and the area where we place the needle for the injection. This is an X-ray picture of the needle being guided by fluoroscopy into the foramen. We use a very specific technique called digital subtraction where we only see the dye so we can be sure we're not putting the medicine in a blood vessel. And this is what it looks like with the final image showing the medicine being placed around the nerve root sleeve. In order to understand why we do transforaminal steroid injections, we'll take a look at some anatomy to help you understand the reasons behind the procedure in terms of inflammation. This is a view of your spine looking at it from the side, and then if we rotate an image, we can get a better picture looking at it from a cross-sectional point of view to help understand what's going on inside the spinal canal. Let's take a look at a drawing of normal spine anatomy, beginning with the outer lining of the disc, which is a strong fibrous band that holds the jelly on the inside of the disc in place, and together they provide stability and a cushion for our spinal canal. Behind this and the back side are the bones that connect each segment of our spinal canal together, and then between the bones of our spinal canal and the disc in the front is where the spinal fluid sac containing the nerves is. At each level, one nerve exits to the right and one nerve exits to the left. In a disc herniation, we develop some breakdown in the fibers in the outer lining of the disc. And this area can become weak, and then sometimes with heavy lifting and sometimes without any clear reason, the disc herniates and creates an inflammatory response that affects the nerves in the area where the disc is herniated, and this is what causes pain to go down the leg. When is a transforaminal steroid injection done? Generally, we try to help people get better without injections, but if you've still got pain after 6 weeks of treatment, or any time that weakness is beginning to develop, or the pain is so severe that you're not able to tolerate therapy, then we'll introduce the option of having steroid injections. This is a common question about whether steroid injections are just a band-aid and not addressing the problem. In order to understand why steroid injections can be so helpful, it's important to understand that the body naturally reabsorbs the part of the disc that herniates over time. In fact, 2/3 of patients get better without surgery, and in 2 years, patients with injections for treatment do equally well as patients treated with surgery. Here's an example of what it can look like. Inside the circle on the left is a piece of disc that's herniated, and months later, without surgical treatment, the body has resorbed that disc. Let's take a look at some common questions that people ask about transforaminal steroid injections. The most common question is whether the injection will hurt, and the answer is sometimes it hurts because we're putting medicine on a very painful or tender nerve, so just being near it can be painful. Oftentimes, however, people find it to be comfortable and relatively easy to have done. Are steroid injections bad for you? Well, in a single dose, the side effects of steroid injections are really quite minor. There can be some facial flushing or rosy cheeks, and if you have diabetes, the blood sugar can be elevated. You need to keep an eye on that. Long-term side effects from steroids are typically associated with long-term use of steroids, and we need to keep in mind that's typically done to treat a medical condition for which the steroids are helpful. Generally speaking, we only do one injection and then reevaluate and see how you do. If you need another injection, it can be repeated, but we don't plan to. The procedure itself only takes 10 minutes, but you'll be in the facility for about an hour to help you get ready and to help you recover afterwards. And please check with us the day before. Sometimes procedure times can change. We do the injections at Northeast Rehabilitation Hospital Satellite next to our office in Lawrence, also at Lawrence General Hospital, and at Lowell General Hospital Saints Campus in the Pain Clinic. The Northeast Rehabilitation Satellite facility is directly next to our office. You can see our office door there on the right and the facility to the left. It was designed specifically for pain management procedures, has everything we need, and is very comfortable. Remember to have someone else with you to drive, because you cannot drive the day of the injection. If you're on blood thinning medications, we'll give you specific instructions about that. And make sure you go to the right place. One of the nursing staff will admit you and give you a personal space to sit and get comfortable, and you'll have a locker to place your valuables. Wearing loose clothes can make it easier for you. There'll be a nurse with you throughout the procedure, monitoring your blood pressure, and this includes doing a timeout. So you'll have to help us by verifying your name and date of birth and what side and what level we're doing your injection. After the procedure, we'll go over instructions. No driving for the rest of the day for your safety and public safety. Get back into your usual routine. Continue taking your medication. Keep up with your physical therapy. And in general, avoid strenuous bending, lifting, and twisting. We'll give you a follow-up appointment to check on you in 2 to 3 weeks. And that's it. We hope you're feeling better soon. We'll be happy to answer any questions you have at any time. In general, this is a safe and common procedure. Side effects can include some pain and discomfort, some numbness from the local anesthetic, some fainting episodes sometimes occur with people that are very nervous, and side effects of facial flushing that we discussed earlier. Serious consequences and risks are very rare and include spinal cord injury and stroke, or injury due to X-ray exposure. The most important individual considerations are in relationship to blood thinning medication that people take to prevent the risk of stroke, and you should talk to your doctor before the procedure and before stopping those medications. And naturally, women, we want to be sure are certain there's no possibility of pregnancy. Please ask any other questions in the office. We'd be happy to go over all of this in detail.